Thank you very much. Thank you, everyone, for being here today. The latest COVID numbers as of Wednesday in Massachusetts, 112,347 cases. That's a one-day increase from the previous day of 217. There has been 8,368 deaths statewide. That's up by 28 numbers. Those numbers combine both the confirmed and probable cases recorded by the state. Boston's numbers as of today, 13,793 cases. That's a one-day increase of 21. This week we've been pretty much averaging about 23 new cases a day. 9,837 people have fully recovered, 35 of them as of today. 716 people have lost their life, and that's an increase of one from yesterday. And as I have been saying, our thoughts and prayers are out to the family members of those sick and suffering from COVID-19, and obviously the families who've lost loved ones. We want you to know that we continue to keep you in our thoughts and prayers. As we move into phase 3, our priorities contain the virus and prevent another surge from hitting our city and our state. I will repeat what everyone needs to be doing in supporting these efforts. I'm going to continue to do that. Wearing face coverings whenever you're outside, keeping a 6 feet distance away from other folks, avoiding large crowds. Wash your hands as often as possible with soap and warm water. Also clean surfaces, doorknobs, door handles in your car, and things like that. That's really important. I would suggest that every time you're in your car, if you have hand sanitizer as well, do that. Follow the public health guidelines for your place of work or business as well. That's the way that we continue to move through COVID-19 in a safe way here in the city. I also want to just talk a little bit about COVID-19 testing. It remains one of our most essential weapons in this fight. It's how we get our data. It's how we can base our decisions on reopening. It's how we also work on getting access to treatment. It's how we contain potential outbreaks before we see those spreads happening. We have expanded testing to this point is widely available all across our city. It's in more than 20 locations and mobile testing sites. And I just want to urge everyone today to please go get a test. Don't hesitate. Testing is covered by insurance if you have symptoms or a confirmed exposure. And there are many sites of testing all across the city at no cost to anyone. Even if you don't think you meet those criteria, we're asking you to take the test. This morning at Whittier Street Health Center, they performed their 5,000th free tests today, coronavirus test, when their health mobile van visited a housing development in Dorchester. So it's incredible to see that one of our health centers hit the 5,000 mark as far as testing. If you want to see where testing locations are in your neighborhood, they're at your health centers, but you can also look up the testing site information at boston.gov/coronavirus, or call health center in your area to see when and what time you can come get tested. Getting tested is certainly good for you individually to know that if you have the virus or if you're carrying the virus. It's also good for your family. It's good progress for our city and the Commonwealth as we continue to move forward here. At the same time, we know that there are barriers to information and healthcare access in many of our communities. Removing those barriers has been a big part of our testing strategy. Since the beginning of our response, we have focused a special outreach and resources on communities where inequities are evident in the case numbers, in testing numbers, and certainly in risk factors. We've done universal testing for the homeless population and our first responders and frontline workers. We've appointed a COVID-19 Health Inequities Task Force made up of leaders in communities of color who understand what resources and services are needed in their communities. Drawing on their guidance, we've expanded testing in the Black community and the immigrant communities here in Boston and in neighborhoods like Roxbury, Mattapan, and East Boston. We've expanded language and communication access to make information and resources available in more than 10 languages. We brought a mobile testing to our public housing and senior communities all across the city of Boston. We've created a COVID-19 immigrant collaborative to combine and expand the relief available in our immigrant communities. In other words, we're working every day to build our strategy to address systemic inequalities. We know where they are, and we've seen this emerging in the data. That work makes our whole response stronger because any outbreak that occurs ultimately impacts everyone. So equity has been a significant reason for our success in containing the virus, and to the extent that we have. And we're going to continue the strategy, working with the task force and maintaining a focus on each impacted community. Today I want to share a couple of new steps that we're taking right now and in recent weeks. We are seeing higher than average positive rates in the Latino community. Latino residents make up 20% of the population here in the city of Boston, but they are 28% of our city's overall COVID cases, and that inequity has grown during the course of the pandemic. So this week we're investing over $400,000 into a community plan to address the inequities that these numbers represent. The Boston Resiliency Fund is providing grants support to the Greater Boston Latino Network, as well as the East Boston Health Center, as well as Whittier Street Health Center in Roxbury, and we're working to expand the partnership with the Brookside Health Center in Jamaica Plain next week. Together, they will expand the outreach and testing related to supports of the Boston Latinx communities. That means getting testing to where it's needed, reaching the families and individuals who face barriers, and provide them with not only testing, but the supports they need to access treatment and stay healthy. The best way to do this work is through grassroots organizations that have long-standing, authentic relationships in the communities that they're working with every single day. That's been the core strategy of the Resiliency Fund and the Health Inequities Task Force, and that's who the Greater Boston Latino Network is. There are high-impact community organizations, including EBA, based in the South End, the Hyde Square Task Force, based in Jamaica Plain, the East Boston Ecumenical Community Council, and others. At the same time, community health centers have been our essential partner in testing access. Now I'm going to invite a member of the task force to say more about the grants and the testing access plan. Reverend Sam Acevedo is Associate Pastor of the Lion of Judah congregation in Roxbury. He is the founder and executive director of the Boston Higher Education Resource Center and a member of the organization of the Greater Boston Latino Network, and I'm honored to have him serve on not only our task force, but on so many other important areas here in the city of Boston. Reverend Acevedo.
Thank you, Mayor Walsh. Honored to be here on this beautiful July afternoon. Virtually since its launch, the Latino members of Boston's Health and Equities Task Force have noted that the data being captured by the state and city did not match what we were seeing firsthand with the Latino families that we work with. Many families reported having symptoms of COVID-19 but were afraid to get tested because of their status, and many were essential workers whose families relied on that paycheck for survival. Even before this crisis, Massachusetts was already the #1 state for Latino income inequities. The pandemic has only proven to increase disparities among socially and economically challenged communities. For many families who do not speak English, it could be bewildering to navigate COVID-19. Some don't have health insurance or a dedicated healthcare provider. Recent data is beginning to demonstrate what we already knew on the ground. Latino COVID-19 cases, unfortunately, are on the rise in Boston, and especially for the 21 to 39 age group. The Greater Boston Latino Network is made up of 9 Latino-led community-based organizations whose goal is to amplify Latino voices and impact and visibility in the Greater Boston region. These well-trusted groups in the community serve a wide range of needs, and just as in previous emergencies, we have pivoted to provide support. Even amid this crisis, we continue to deliver our usual programming, from working with the elderly to running after-school academic enrichment programs for youth. But we're now also delivering food, working with families to file unemployment, distributing direct cash assistance, and connecting families with a multitude of services. With these funds that the mayor just announced, GBLN will continue to provide the expanded resources that have been the result of this pandemic. We will also work with the East Boston Neighborhood Health Centers and the Whittier Street Health Center to strengthen the work that they're doing with the Latino community in efforts to spread accountability and safe practices We'll be running a campaign to reach the population from the 29 to 39 age group through outreach with prevention messages and distributing masks. We will also embark on beginning today on a bilingual campaign to promote mask wearing among the Latino community. We are grateful to Mayor Walsh for all of your work to date in keeping all of Boston residents safe. And we're also immensely grateful to Chief Martinez for his leadership early on in reviewing data and forming a task force to address the health inequities for our Black, African American, and Latino residents, making Boston one of the most successful cities in America now in combating this health pandemic. And if you permit me, I will translate some of these remarks into Spanish. Desde hace tiempo, los miembros latinos de la Junta de Salud de Igualdad de Boston, the Health and Inequities Task Force, han dicho que los datos reflejados por el Estado y la ciudad no coinciden con la realidad que vemos en la actualidad entre las familias latinas que tenemos el privilegio de servir en esta ciudad. Aunque muchas familias nos informan tener síntomas indicando la presencia de COVID-19, muchos resisten a hacerse la prueba de COVID-19 debido a su estado legal o simplemente por temor a las circunstancias. Muchas familias latinos dependen de sus empleos como trabajadores esenciales, dependiendo de recursos económicos necesarios para mantener sus familias. Massachusetts ya era el estado número 1 representando la desigualdad de ingresos entre la población latina y otros grupos étnicos de este estado. La pandemia solo ha aumentado la desigualdad en comunidades ya confrontando desafíos sociales y económicos. Los datos más recientes comienzan a mostrar lo que ya temíamos instintivamente. Los casos latinos de COVID-19 siguen creciendo en nuestra comunidad, especialmente para latinos entre la edad de 21 y 39 años. La Red Latina de Boston, Greater Boston Latino Network, está compuesto de 9 organizaciones comunitarias dirigidas por líderes latinos. Nuestro objetivo es amplificar las voces, el impacto y la visibilidad de la comunidad latina. Estas organizaciones, respetadas en la comunidad, satisfacen una amplia gama de necesidades y al igual que en emergencias anteriores, hemos girado para brindar apoyo durante esta crisis de salud. Esto incluye los esfuerzos heroicos que ya ejemplificadas por estas organizaciones, desde trabajar con personas mayores de edad hasta ejecutar programas de enriquecimiento para nuestra juventud. Pero además estamos entregando alimentos, trabajando con familias para prevenir el desempleo, distribuyendo asistencia monetaria directa y conectando nuestras familias con la multitud de servicios disponibles. Con estos fondos, GBLN continuará proporcionando los recursos ampliados que han sido el resultado de la pandemia. También estaremos trabajando mano a mano con el Centro de Salud de East Boston y el Centro de Salud de Whittier Street para fortalecer el trabajo que están haciendo con la comunidad latina. En este esfuerzo, llevaremos a cabo una campaña dirigida a la población entre las edades de 21 y 39 años mediante mensajes de prevención y distribución de máscaras. Muchas gracias al alcalde Walsh por todos sus esfuerzos para mantener seguros a todos los residentes de Boston. Gracias y al jefe Martínez por vigilar los datos desde el principio y formar una junta, un task force, para abordar las iniquidades en salud, particularmente entre nuestros residentes negros, afroamericanos y latinos. Muchísimas gracias.
Thank you, Rev. Thank you very much, and thank you for all the members of the COVID-19 Health and Equities Task Force. We've seen in this pandemic that we're still in, that we're only as strong as the most vulnerable neighbors, and working this powerful, working is evident of how equity makes our city stronger. So I want to thank you for all your great work. Before I move on, I just want to talk a little more about the Resiliency Fund. I want to mention that the other work in our community that the Resiliency Fund is supporting this week is a total of $1.2 million in grants. Much of it's focused on programming to keep young people engaged over the summer, food distribution to continue to make our families and seniors not go hungry. For example, we're providing 400 new Chromebooks for young people at their work for summer job program run by the Department of Youth Engagement and Employment. We're supporting the Guild, a community space in Four Corners led and owned by people of color. The Guild has been distributing food, diapers, and other essential items to families in need. We're also going to continue to support the Chinese Progressive Association, who are staffing and putting people back to work at the city's distribution food hubs. Other partners include United South End Settlements, Transgender Emergency Fund in Massachusetts, Viet Aid, Caribbean Youth Club, My Brother's Keeper 617, and Turn It Around in Charlestown. The fund to this point has distributed $24 million. 53% of those grants have gone to organizations led by people of color. And that's having a very positive, equitable impact across the city in a very difficult time. And normally I would not confront something I hear on the radio, but an hour ago there was a city councilor talking about the Resiliency Fund and I think the ineffectiveness of it. And if the city councilor took time out of her schedule just to give me a call, or maybe go on a call to talk to us about the Resiliency Fund, she would understand what the Resiliency Fund has done. And I want it to be very clear, the Resiliency Fund has raised $33 million, all privately raised, by 1,700 different donors. We've distributed over $24 million. 53% of those have gone to businesses and or industries of color. What we've been able to do with that money, quite honestly, is put food on people's table so they don't go hungry. What we've been able to do with the money is expand testing to our community health centers to allow them to take care of and actually give tests to vulnerable people, vulnerable populations that wouldn't have otherwise access to health care. We've been able to expand telehealth medicine. We've been able to buy Chromebooks for our kids in our schools so they could do online learning. We've been able to make large donations to programs like the Greater Boston Food Bank, and also large donations to Project Bread and other organizations in our city that provide food to people. We've been able to deal with the Health Inequities Task Force, like the investment we're making today. So when I hear people talk about how it's not effective, they should take a little bit of their time to learn about why the fund was set up and what the intention of the fund was, and maybe help us get some money for the fund rather than Monday morning quarterback on a radio show when they have no idea what they're talking about when it comes to resiliency funds. And I am proud, and I want to thank the 1,000+ people who've donated to the resiliency funds. You have made a tremendous difference and an impact when it comes to helping people stay healthy and safe. So I want to thank you for that. We know also that there's a long way to go in this fight. I'm urging Washington to take action now and bring more relief to cities across America, in states, and individual Americans before economic disruption becomes economic disaster. I know there's lots of anxiety and concern out there. I hear it every day. And I want to make sure that people know one concrete thing that they can do. Whatever resources are available, they'll all be distributed based on the census data. The 2020 census is going on right now, and we need to make sure that everyone gets counted in our city, in our state, because everyone certainly counts. We need to make sure that the city of Boston and the Commonwealth of Massachusetts receives its fair share of funding from Washington, D.C. I'm asking everyone, if you haven't done it yet, please fill out a United States Census form. You can go online right now, my2020census.gov, or over the phone in 13 different languages. Our city's current response is under 53%. That's lower than the national average of 62%, and it's lower than the statewide average of 64%. It's not unusual for a big, diverse city, but we need to get those numbers up to make sure that we get the representation and the resources that our residents in the city of Boston deserve and need. Census work will be knocking on doors and starting August 11th if you haven't responded. In the meantime, we're offering tools to help you. The Census Bureau has started a mobile operations to visit public spaces and gatherings with appropriate distancing and PPE to help people fill out the census form. As a reminder, in Boston, we are not approving any events of over 50 people. If you want to bring the census or your staff to a community, we're asking you to reach out to our liaison by calling 311 or visiting Boston Counts 2020, or go to the webpage for boston.gov. This really does make a big difference in the census. Over the last three censuses, we've lost representation in the United States Congress. With the way population has gone in the Commonwealth of Massachusetts and the city over the last several years, we've seen an increase in population. We need to make sure that that population gets counted, because what we don't need to do is lose any more seats in Congress. What we need to do is gain our representation in Congress. So by filling out the census, you're not only helping your elected, your position at Congress, you're helping all of us here in the Commonwealth of Massachusetts, including yourself. Before I take any questions, I just want to address one other thing that happened Tuesday night in Boston. It was apparently someone was committing a robbery and shot a store clerk in Roxbury in a brutal, cold-blooded act of violence. The victim's a 23-year-old man. He was an immigrant from Bangladesh who went to work on Tuesday to earn money and try to stay safe from COVID-19. Now he's in the hospital fighting for his life. My heart breaks for him and his family. The commissioner is going to talk a little more about crime and the police department investigation, but I just want to say how frustrated and angry I am right now in dealing with this cruel sense of violence. We have seen too many of them this summer. We've seen too many homicides this summer. We've seen too many shootings this summer. We're working every day to eliminate the root causes of violence here in Boston. But someone committing a crime like this makes a choice to inflict pain and suffering on a fellow human being and continue the violence and trauma in their community. They need to be held accountable for those choices and those harms. The violence in our city needs to stop. We need to take responsibility. I was at a homicide the other night with the commissioner and the DA where a 15-year-old was killed. And at that night, Commissioner, the DA, and myself thanked the community. Thanked the community for who they are in our city. I asked that night for the people committing the crime and the violence to stop. I'm telling you today to stop. This young man was working. He was an innocent person working in a store. The circumstances around the shooting I can't get into right now. But in Boston, we're better than that. There's no excuses for violence in Boston. It's not how you were brought up or not the circumstances your hands were dealt. When you go out and commit harm against another human being, we're going to hold you responsible. We're going to hold you accountable. And again, as I said the other night on TV, I know the people that are committing the violence in Boston, they're not watching the news. They're not watching this press conference. But maybe some people that know them are. And I want you to pass that message along. Because what happened the other night, where there's a 15-year-old in the streets, an 18-year-old, a 17-year-old, a father of 3, a person working their job, the last thing they should be worried about is not going in the home that night. So I'm asking people, please, talk to the folks in the neighborhood. Let us know. With that, I'm going to turn the microphone over to Commissioner Gross to say a few more words.
Thank you, Mayor. afternoon, everyone. You can see my frustration. A young man working in a convenience store. A convenience store is a staple to the community. You don't have to go to the big name stores. You're in the neighborhood. You can go there to get medicine, food, whatever, for your family. A young man from Bangladesh comes here to Boston to seek a better quality of life. And then a coward, trust me, a coward, shoots him during a robbery. Take the money and leave. Why commit a cowardly act like that? That was an innocent young man. And God bless him and his family. God bless all of our shooting victims. And the mayor's right. We're tired of this. You know I've been very vocal before about the fact that the mentality in the street is you can do what you want because the courts are closed. No grand juries, no court. And I know for a fact you see me work hand in hand with the district attorney saying that repeat violent offenders should be held accountable. And that's important. Accountability. Want to know why we need accountability? Because our neighborhoods deserve it. How dare you ask if you see something, say something, and when you do, and when the person is arrested, then they're back out on an electronic bracelet or a stay away. Because guess what? Before the shooting of this young man, 3 nights before that, there was another young man shot. The person arrested was arrested with a firearm, had been arrested 4 days earlier with the firearm, wearing an electronic bracelet that he cut off to commit that shooting again that night. Are you kidding me? So yeah, I actually go to the streets and speak to the people. I just spoke to the store owner, and he, like other people, are traumatized, and they want answers. I'll tell you one answer you're going to get. The Boston Police Department will continue to work with the communities. I just talked to the store owner. We're going to meet. We're going to talk about how all convenience stores should have cameras, should work in partnership, know the officers, and again, take care of the community. As I always state, before I wrap it up, our communities are not desensitized to violence, they do care. They've been helping us make arrests not only in persons carrying guns, committing dangerous acts, but actual homicides. Folks, let's continue to stick together and work together so that we can send a message to the repeat violent offenders and violent offenders that you will be locked up and held accountable. I only hope that the judicial process is listening, and we should not be bailing out people, putting them on electronic bracelets when they get arrested with firearms. Just sending the wrong message. For anyone that's traumatized, please access this number, 617-431-0125. We're here to work with you. And as the mayor said, any of the Monday morning quarterbacks, I haven't seen you on the street. So stop criticizing, get out and do your job, and take care of your constituency. So we can all stop criticizing and work together to make this city as safe as it can be. Thank you.
Any questions? Yeah, I'm going to ask Ronnie Martinez, Chief Health Human Service, just to explain. The answer is yes, but I'm going to have him talk a little bit about it.
Sure, Mayor. So yeah, absolutely. I mean, we want people to access testing across the city, and that includes whether you are symptomatic or not. If you've been in large groups, if you've been socializing, if you've been going out, but you're asymptomatic and you don't have any symptoms at all, we still encourage you to go get a test. We've lifted up. We have the capacity across the city to do about 2,000 tests across the city. So we have the capacity to do it, and we encourage people to get tested. Absolutely. If you're putting yourself in situations where you're interacting with others, where you're going out, where you're connecting with folks, and maybe not keeping the social distance as you should or having your mask on always, you should get tested regularly. The point is that to contain COVID, we have to make sure that people know their status and then are able to distance themselves from others and keep their families and themselves safe.
Anyone else?
Why do you think people are?
Say again?
Why do you think people are criticizing
I've only heard one person criticize resiliency fund. I haven't heard anyone else. As a matter of fact, we've gotten hundreds of thank you letters from organizations all across the city thanking us for the investments and helping people. That's a question you'll have to ask them. Any other questions?
Convenience store shooting robbery, any more investigation to reveal about it?
We continue to get tips in. Please access 1-800-494-TIPS. And as the investigation processes forward, hopefully through a fruition and an arrest, we'll keep you updated through the Office of Media Relations. But again, folks, this is time for us to stick together. Forget the critics. They're never in the streets anyway. They just talk. So the people that are actually out in the community that actually do care, we need to stick together to, again, stay together in solidarity and hold people accountable. And yeah, use your voting power. Come on now. There's too many times this year we were seeing the same thing. Repeat violent offenders get bailed out to commit another crime, or murderers get released. What kind of message do you think that's sending? So again, please use your common sense. And for we the people that are out in the community, it's time for us to use our voices and the power of our vote and to talk to your politicians, talk to me, to hold people accountable and that they do their jobs. Again, telling people if they see something and say something, you let these very people go back into the community is ludicrous. So again, we're not giving up. I believe in our communities, and I know they're going to work with us. So we'll keep you updated on the investigations. Thank you.
I just want to follow up on you, Sean. I think some people that are criticizing the resiliency fund might want to run for higher office. They better find a better issue than that to run for higher office. Any other questions? All right, thank you.